why not just put it in there? But what does it do to another drug that may have a positive benefit? So you want some rationale for saying, yeah, it should be there, and we're worth putting in there and taking the risk of putting it into the combination.
Dr. Porter,
Yeah.
how long until this can be used for newborn screening?
So, newborn screening. So, first step would be getting it in as a diagnostic screening. So that's being worked on now. What we need to go to now is, for example, get a large group of patients, undiagnosed patients that have splenomegaly, a group of patients that have hepatosplenomegaly or bronchitis at birth. Those initial presentations, or more importantly now, in psychiatric populations. And what the attempt is now is to get large groups of those patients. Actelion obviously has an interest in identifying those patients, so they're working on getting some of those groups. They're doing the classical diagnosis in them, and in parallel we'll run the oxysterols. So that will give us what are the real-world sensitivity and specificities of this test. That's probably the first step. Then the next step is, will this work in a newborn screening setting? And I'm going to remove all the political, state-based aspects. Newborn screening is run at state level, so can be issued state to state. The first question, and we actually haven't looked at it, is what does the blood on a newborn screen, blood testing card. When your babies are born, there's a heel prick, and they put drops of blood on the card, 5 drops of blood, and that's the system used. Obviously, that blood's exposed to oxygen. So the real question will be, what happens to the cholesterol that's sitting in those cards, going through the mail system? And we have collections of those cards, so we can ask the question, but we just haven't gotten there yet.
You mentioned the middle one, I think the one that had the biggest delta between the normal and or the control and the NBC.
So the trial?
The trial and those two. There were some outliers there. I was just wondering if those told you anything. And then there were 2 outliers, one red, one blue.
Yeah.
The question I had is, does that chemical itself tell you anything about what may be in the disease process, or is it just something that represents damage or inflammation or something like that?
I'm trying to interpret what I think your question is. So first of all, the outliers. 7-keto cholesterol, we found outliers in heterozygotes. We actually found some outliers, I don't know if they're outliers, in some Gaucher patients that we screened. So those, I think, are questions to try to characterize that further. It just may not be as good. Or we need to start looking at those outliers to say, is there something different about them that causes them to be outliers? The triol, we haven't seen it with, but the 7-keto cholesterol, there may be, when you're looking for NPC, there may be an error rate in it. But as we collect and figure out who those patients are and find more of them, it could come down to a drug that they're on or something, or this is another subgroup of humans that has some gene variant that might be interesting in and of itself. We don't know yet. Then I think the second part of the question, so you could ask it, and correct me if I'm wrong, I'm trying to interpret your question. Are the oxysterols part of the disease process? Are they bad themselves?
Or do they tell you something about the disease process?
So I think they originate because the disease process is this accumulation, this intersection of increased oxidative stress with lots of free cholesterol. And what we're looking at in the blood is coming from the liver, almost assuredly. So I think it tells you about that disease process. We've tried looking in cells and seeing if we try to make correlations between the esterification, the severity of the cellular phenotype. That's a hard measurement. That's not a good measurement in itself, so we can try correlating against something else, and we're not getting much there. Could the oxysterols be causing damage themselves? Oxysterols are biologically active. We do not know in NPC whether these particular sterols are contributing to the disease phenotype themselves. But oxysterols are biologically active. In other disease processes, I believe they do contribute directly to the disease process themselves. So there's a potential there that they're bad, but that's just potential. It's purely hypothetical at this point. And don't go home thinking that we got to get the oxysterols down because they're bad themselves. It's something we need to pursue.
So, do you understand that you're now looking for various groups of just flower?
Or can you repeat the question?
Yeah.
Okay. Sir,
Okay.
do I understand you right? Did you state that you are now looking for various groups of Niemann-Pick type C patients, such as in the psychological department, or Niemann-Pick patients that have psychological problems, and other Niemann-Pick patients that just have other onset or symptoms? Mm-hmm.
So the answer is yes. So the natural history trial is ongoing. I think the numbers that I showed you in this data, and this will tell you a lag sometime in processing data through, was 25.
Mm-hmm.
We're now up to 52 patients in that trial. We're very interested in patients with variable phenotypic presentations.
How do you go about getting them? Do you work with Germany as well and all the other countries?
So there are efforts. We're definitely tied in with the UK group. The German group, I know they know, and obviously the French group know about this assay. So working to, it can be done anywhere. It's not that complicated of an assay for people who do this type of stuff. So it can be spread out more widely. We will be taking through the samples from the natural history trial. We will soon double this number, but we will also have some, especially with the NAC trial that saw patients over time, we'll get some idea of how does it change in an individual patient across time. So in the natural history, we're talking 6 to 12 month blocks where we saw patients. In the NAC trial, we're going to get information, especially in the control phase, over a period of 8 weeks. How does it change every 2 weeks? So yes, we are looking to extend how robust is this across the full phenotypic spectrum of NPC.
Now, you have the blood work of a lot of patients over a lot of countries from when they first got diagnosed. In order to get the groups together, would you now get in contact with the parents to see, let's say for instance, Jay, my son, he has a very high psychological problem. Would you get in contact with the parents to ask them if they're willing to participate in the research, to go to the lab every 2 weeks and have blood work drawn? Or
So currently what we have, from our conversation earlier, I know you just moved to the States.